Okay, so without further ado, let's get 5 minutes reading time on the clock, and your time starts now. Case 1. Candidate information. You have 15 minutes for this case. You should treat this consultation as if it was face-to-face. A patient record summary is provided for your information. Perform the following tasks within the case time. 1. Take an appropriate history. 2. Explore the patient's concerns. 3. Explain your management plan to the patient. Patient record summary. Name: John Mather. Age: 45 years. Indigenous status: not Aboriginal or Torres Strait Islander. Allergies and adverse reactions: Bactrim, rash, mild. Current medications: nil. Past history: appendectomy in 2020. Social history: single, living in own house, working as an engineer. Family history is not significant. He is not a smoker. He drinks 2 standard drinks of alcohol 1 to 3 times per week. His immunisations and preventative activities are up to date. Scenario: John Mather, aged 45 years, presents with altered bowel habits. He reports alternating constipation and diarrhoea for several months, along with the sensation of incomplete emptying of his bowels. He has no significant history of similar events. Vital signs have been taken by the nurse prior to the appointment. Heart rate 76 beats per minute. Blood pressure 134 on 82. Temperature 37.1 degrees tympanic. Weight 78 kilograms. Height 176 centimetres. BMI 25.2 kilogram per metre squared. Right, so your case time starts now. Oh, hey doc, thanks for seeing me.
Oh, hi, John. No problem at all. My name's Sanal. How can I help you today?
Yeah, look, I've just been feeling a bit off, My bowels have just been a bit everywhere, and I thought, oh, I should probably get it checked out.
Sure, sure. Thanks for coming in, John. Could you tell me a little bit more about what you mean by bowels everywhere?
Yeah, I just keep getting bloated, and kind of one day I'll be constipated, the next day I'll have kind of diarrhea, and I just don't know what to do about it. It's getting a bit embarrassing. I'm having to kind of run to toilets and stuff, and try and find make sure when I go somewhere that there's going to be a toilet close by, and just can't keep
Mhm.
living like this.
Yeah, yeah, no, that sounds really like it's really taking a toll on your life. I'm sorry to hear that, John. Was there anything else that you were experiencing other than this change in the bowel habit?
Yeah, well, the other day, it's about a week ago now. I had a bowel movement, and I think there was some blood or something in there. So I thought, oh, I can't really ignore this anymore.
Oh, okay. Yeah, no, it's good that you certainly came in to discuss that. Could you tell me a little bit more about the what you saw?
Yeah, so it was kind of some brightish kind of blood that was all just kind of mixed through it there.
Mhm,
Didn't hurt or anything like that.
mhm, mhm,
I had
mhm,
another episode a couple of days after that as well. That
mhm.
yeah, same kind of thing. Um, once I cleaned myself up, the next time I opened my bowels, there I couldn't see any blood there. But yeah,
Sure, sure. And was there anything else that you've noted, or is this the main kind of things that you've seen, like the altered bowel habit and the blood?
oh, they're the main things I think
Main
I've
things.
noticed. Yeah, what
Sure,
other
sure.
stuff should I be looking out for?
Oh, look, there's a few more things like, sometimes the stool can become, paler or you can lose weight and things like that. But we'll come to that just in a second. Is it all right if I
Mm.
ask a couple more
Yeah,
questions,
yeah,
John,
go for it, mate.
just about
Yeah,
you, Jen? Fantastic. How long has this been all happening for?
look, I probably first noticed it probably a couple of months ago, probably 4 or 5 months, I guess. Didn't
Right.
think too much of it. It wasn't too bad at the start, but it kind of
Sure,
just keeps
sure.
happening.
Sure, sure. And did you think anything could have triggered it or brought it on, or you're not
No, not
sure?
not much else has changed. Work's the
Sure.
same. I still eat the same kind of foods, so yeah,
Sure,
no
sure,
idea.
sure. Yeah, all right. And just some general questions, I guess, about your health in general, John, just to find out, trying to get to the bottom of what's going on, if
Mm.
that's okay. Have you lost weight at all recently, or?
Yeah, probably have actually. I kind of thought it was probably just because I was going to the toilet so much. Maybe
Sure.
5 or 6 kilos in the last couple of months.
And was that unintentional, or?
Yeah, I haven't been doing more exercise or anything, and my diet's pretty much exactly the same. So
Sure, sure. Are you waking up at night drenched in sweat at all, John, or?
no, not that I've noticed.
Okay. And have you noticed any other pain anywhere, maybe in your bones or anything like that?
Not significantly. No, no.
Okay. What about any
Occasionally,
lumps or,
occasionally
sorry,
get a
what
little
was it?
cramp in the stomach, but
Stomach,
it's
yeah, okay. Some stomach cramps. All right.
yeah.
Any lumps or bumps anywhere in your body?
No, not that I've noticed.
Sure. Do you get diarrhea at night?
Yeah, sometimes. Yeah,
Mm-hmm, mm-hmm, mm-hmm. And that blood was bright red, and you said it was mixed in with the stool. Is that right?
yeah, that's right. Yeah.
Was it dark tarry stool at all at any point, or?
No, no, it's relatively bright, not like fluorescent red kind of thing, but
Sure.
yeah, it wasn't dark.
Sure, sure. Okay. And are you okay with your swallowing? Any issues there?
No, no troubles with swallowing.
Sure. And you mentioned some stomach cramps. Is that pain as well, or just mainly cramping, or?
Yeah, mainly kind of cramping. Sometimes it's worse when I can feel I'm a bit more bound up.
Sure,
Yeah.
sure, sure, sure. All right. And I guess just in terms of your background, I did read
Mm.
here family history. There's anything significant? Was any bowel cancer in the family, you know?
Maybe there was an uncle or something. He had some kind of cancer, but I don't really know much about it. We weren't too involved with that side of the family. But yeah, now
Sure.
that you say it, bowel cancer sounds familiar.
Oh, okay. But you don't know who had it specifically, is
No.
it? Or the age? No, that's all right. That's all right. Not many people do. That's okay. Is there any family history of or have you noticed any unusual like mouth ulcers anywhere in your mouth or anything like
No,
that?
not specifically, no.
No. Okay. Have you had any issues with gluten before? Like,
No, no.
wheat,
Eat bread all the
rye?
time, always have. Never been a problem.
Sure,
Mm.
sure. And in terms of travel, have you been overseas anywhere?
I wish. No,
Yeah,
no. Just
okay.
just hung around home.
Sure, sure. All right, no problem. And just to clarify, sorry, did you report any vomiting or?
No, just recently I've been feeling a little bit seedy, but yeah, I haven't thought too much of it, to be honest. Do you think it could be related?
Potentially. By CD, do you mean nauseous, like you're
Yeah,
sick,
little
or
bits of
yeah?
nausea. Yeah, yeah.
Okay, yeah, potentially. Yeah, it could be linked. Do you have any allergies to anything like lactose, milk, any allergies like that,
No,
or
no food allergies.
no food
I
allergies?
had Bactrim when I was a kid. I came out in a bit of a rash from it, but I don't remember. I
Sure.
was too young at the time.
Sure. And any issues, like any specific change to weather? Like, do you prefer like more colder weather or warm weather, anything like that? Or
Well, where I live is pretty hot, and I've always liked it
oh,
there. I
you like
don't
it?
really
Okay,
like cold, but there's nothing's
sure.
really changed.
Nothing's changed, no problem. No worries. And just in terms of your medications, it's I don't have any. Oh, it says you're not on any medications. Is that
No,
right?
I've
Are you on any
never
blood
needed anything
thinners?
before.
No aspirins or no blood. Okay, fantastic. No worries. And did you have any other questions so far?
What do you think it could be?
Yeah, John, look, I'm a little bit worried with what you're reporting, the change in the bowel habits and the tummy pain. And I guess you did mention some weight loss as well, unintentionally. I'm just a little bit worried about something like bowel cancer. I'm
All
not
right.
saying it definitely, yeah, I know it's a lot to take. I'm not saying it's definitely that, but I am a little bit, that's something we don't want to miss.
Yeah.
If it's okay, I will come back to that and I'll just explain my plan just in a second. Is it all right if I ask you a couple more quick
Yeah,
questions?
definitely. Yeah.
Yeah. Do you smoke at all or
I smoked a little bit when I was a bit younger, but not now.
not now? Okay, fantastic. And any alcohol?
Just a couple of beers, kind of once or twice a week. Nothing
Oh, okay,
major. Not
nothing
much of a
major.
drinker.
Sure. And something I ask all my patients, but any recreational drug use?
No, nothing like that.
And you touched on your food before your diet. Can you just elaborate on that for a little bit more for me, please?
Yeah, generally pretty good. I'll have a bit of toast for breakfast. Lunchtime, normally have a salad, some chicken or something.
Mm-hmm.
Um, Dinner's kind of a steak and two veg, three veg kind of situation.
Would you say you eat a lot of charred meats in your diet? You know, like burnt kind of meats, or like
Yeah,
red
lots of steak
steak,
and stuff.
steak.
Yeah,
Okay,
yep.
sure. And any exercise that you do, John?
Yeah, try and go running probably every second or third day. Depends on the
Ah,
weather. Now
okay.
it's a bit colder here. It's a bit trickier for me to get up in the morning, but generally
Yeah.
speaking.
Oh, that's fantastic. I wish all my patients did that. So that's good to hear. All right. Yeah. So look, John, just getting back to the matter at hand, I know I brought it up before, and it probably is a bit of a
Yeah,
shock to you for me to mention that. But it is something important and we shouldn't miss it. Something like bowel cancer. Look, I'd love to just organize some blood tests for you if that's okay. You'll check your blood count, because you mentioned some bleeding. Just have a look at that, your liver, your kidneys, maybe your iron levels as well, and potentially even your thyroid test and a stool sample as well. If that's all right, we just get that done for completeness. But I guess the main thing, or I guess the elephant in the room is about talking about a referral to a gut doctor called a gastroenterologist to do a camera test of your back called a colonoscopy. Essentially, they put a camera in there to have a
it
look.
doesn't sound fantastic.
I know. Yeah, not the moment I bring it up with patients, no one is happy.
Yeah,
But I can assure you, you're under sedation. You won't feel anything really because you'll be
yeah, good.
asleep. And it is a very quick one nowadays. It's often done in like 30 minutes. Sometimes it's very quick, and they can go in and just have a look and see if there's
Yeah.
anything suspicious there. Take a sample if need be, because ultimately I don't want to miss something like that for you. What are your thoughts about that, mate?
Is it dangerous?
Look, good question. It's often any procedure carries risk. Nowadays, it's actually really well tolerated. The gastroenterologists are really well trained to do it. There's always a risk with any procedure like infection and bleeding because they're introducing a foreign object from outside. There is a very rare risk of perforation of the bowel. I know it sounds scary, but it's extremely uncommon, but something we do have to mention. And there's always a risk to the anesthetic and reacting to the anesthetic. But that's with any procedure that has that risk. In your situation, I believe the benefit of doing that procedure would probably outweigh the risks of the procedure, but obviously it's entirely your decision with regards to that.
Yeah, right. Okay.
Yeah.
Is it?
What
What else do you have to do for it? So you just rock up to the hospital?
Yeah, so essentially what we can do, so it depends on whether you want to go through the private system or the public system. So did you have any preference or?
Oh, well, I've got the private health cover. I may as well use it. I'm paying for it.
Yeah, yeah. So look, I can submit a referral to a private gastroenterologist. They do often book you in into their private hospitals. So they often work in conjunction with a private hospital, sometimes a public, but they'll probably book you into a private. And yes, you do rock up to the hospital. Often there is a bit of a preparation required before the procedure. They give you a I can't remember the exact name of it off the top of my head. I think it's something like I think it's glycoprep or something. I'll have to look up the name, but they give you a certain sort of a preparation
I
solution.
think my father had that a couple of years back when he had to
Yeah,
go for this. That sounds familiar.
yeah, and they kind of clear your bowel before, and you do need to have like be on a liquid diet a few hours leading up to the procedure as well. So it is a bit of a hassle in that way, but
Well, that's my
ultimately,
weekend planned.
yeah, yeah, that's right, that's right.
Okay.
What do you think? Any other
Oh, look,
questions?
if you reckon I got to do it, I should probably do it. I mean,
I would, yeah, yeah.
could it
Sorry,
be
go on.
anything else?
Look, there are other causes for changes to your bowel habits. Sometimes people have sort of inflammatory bowel disease, things like Crohn's, ulcerative colitis, you might have heard of, can cause it. Sometimes even celiac disease can cause it as well. Occasionally, certain parasites, like things like there's certain bacterial, like Giardia, things like that. But I think it's unlikely for them to present with something like this in your age. I haven't personally seen that before. I think those are things in my mind, but they're far less likely. But I think, yeah, those are other possibilities as well, to answer your
Yeah,
question.
right.
Yeah, yeah.
Okay. And how long's this all going to take?
Yeah, so in the sense of like seeing the gastroenterologist and the whole process, or like
Mm.
getting like the bloods
Finding
done,
out what's
or
going on.
yeah, look, it's often pretty quick. So what the gastroenterologist does is they look through the bowel, and they often have a report. They take photos of your bowel as well, and they'll have a report to you. I'll organize it urgently. I'll refer you as soon as possible if it's okay. If you
Yeah.
give me your permission, I'll give them a ring today to one of the private gastroenterologists and organize a referral for you as soon as possible within the next day or two. Just get you in. And then, if I mention, we're looking for something like bowel cancer, the gastroenterologists are very fast. They'll get the procedure done and get the report back, within a day, as soon as possible. So I'll write that on there. And if you give me that permission, I can contact them urgently today if you're all right with that.
Yeah, that'd be fantastic. Thank you.
Sure, sure. Any other questions you had?
No, I think you've answered everything for me.
Mm-hmm,
Yeah,
mm-hmm.
really,
Yeah.
really appreciate your work today. Thank you.
No problem, no worries. Yeah, yeah, all good. Yeah, I think a little bit more time. I guess, look, it is a big impact for you with all this. Is there any family or anybody you want me to speak to regarding this? Is there any friends you want to?
Oh, look, I'll probably wait until the results come back in, I think,
Sure,
before
sure, sure.
worrying
Yeah,
other people, just in
yeah,
case it turns
yeah.
out to be nothing.
Absolutely, you're absolutely right. Yeah, 100%. Um, yeah, I think. Oh, sorry. And I think yeah, I mean, with the alcohol, you said there's not much that you drink or anything. Yeah, it's just a couple of beers, you said, right?
Yep.
Yeah,
Yeah, just a
yeah,
couple beers.
yeah. No worries. Yeah. No
All right.
worries.
Now,
Yeah,
uh, in the actual CCE cases as well,
yeah.
you'll have exactly this happen where there's this awkward kind of
Okay.
oh I'm done,
Okay.
but there's still that
Yeah,
time on the clock. So
yeah.
have a think about other things you might want to kind of clarify, ask again if there's any other
Sure,
bits of information.
sure,
We still
sure.
have 1 minute left.
Yeah. Uh, John, just when you have a chance, I guess I'll get you back in, just to have a bit of, it's probably not relevant right now. We need to sort all this other things, but just about your diet, I guess, you mentioned eating quite a bit of steak and red meats. So we'll just have a chat about maybe introducing some sort of cereal type foods, sort of the more high fiber cereal foods to protect against things like bowel cancer going forward, I guess. So we can get you back in to discuss, sort of high fiber veggies and fruit, maybe a little bit more of the oily fish and and you said you exercise regularly, which is fantastic. The more you can do, the better, really. So I guess I'll get you back in and we can have a chat about that. I don't think your immunization, I mean, you're 45 at this stage, so we don't need to worry about that too much at this stage. But I think your diet and exercise we'll have a chat about another appointment if you're all right with that.
Yeah, sounds great. I'll book that in.
No worries.
Beautiful. Well done. You can bulk bill me, can't you?
Yeah, sure. No worries.
So that is time, and very well done, mate. So first thing I've got to say is your rapport building's fantastic. I think you have a really nice conversational tone, and it's that reflection that I think you can tell from a mile away. You have done the work. You've seen patient after patient, and this is just something you've practiced and practiced and practiced. So well done. And particularly when it's over computers as well, it's always that little bit more disjointed. But I really enjoy your communication style.
Thank you.
So this case in particular was really aimed at several things. So identifying kind of red flag conditions that you don't want to miss, conveying potentially bad news and that signposting aspect, as well as implementing an appropriate safe plan for a consultant level GP. Happy to say you absolutely smashed it. Really, really well done. I really enjoyed as well the fact that you started out with those nice broad questions to kind of hone in what are the things I'm trying to target, and then, as you would do on the day as well, given time's a limiting factor, start to ask those more direct questions as well to get those answers out. You got essentially all of the history here, which is absolutely brilliant. I was very happy as well that you did get back to double check about the follow-up there, because it's a part of implementing that kind of plan of what you're going to do is then the follow-up plan and the safety net as well. So one thing you probably could throw in just for that final section there is, hey, if this happens again and there's lots of bleeding, you probably actually need to pop around to the emergency department. Otherwise, we'll continue on with this outpatient role.
Sure.
But again, that's something I'm positive you would have done on the day kind of thing in real life. This is always a bit of an artificial setting. Now, I've just thrown up again the kind of structured approach that I use. And again, you kind of absolutely smashed it there. You got all of the important information out. Was there anything about other aspects of management you would have pursued, do you think? Or
not too sure. Maybe, I mean, I guess it's a big diagnosis for him. So maybe, I don't know, like his mental health and psychological aspect. I'm not
yeah,
too
no.
sure.
Actually, I hadn't thought of that. Truth be told, but definitely something you want to be flagging and reviewing. You can do kind of bladder and bowel diaries as well to see if there are patterns. You can throw in a food diary to see if there could be potential ingestions contributing. And if one thing I probably would flag is that if we are doing this via telehealth today, you would say, look, it's probably also worthwhile I bring you into the clinic and we do a PR exam just to see if we can feel anything there that might be concerning. Because the second you put on a referral note with a firm mass palpable, you're going straight to the top of that waiting list. Otherwise, mate, well done. I think you're very ready for the CCE exam. And I don't think you have anything to worry about at all. So thank you very much for being our first guinea pig in this CCE experiment.